You're listening to the Productive Therapist Podcast, the world's greatest and most brilliant resource for busy therapists who'd rather be laying on a beach in Hawaii. Each episode is packed with simple tips and inspiring insights from the Productive Therapist team to help you grow your practice and have fun doing it. So without further ado, let's help you get more done and have more fun.
Are you losing clients because inquiries slip through the cracks? Simple Intake is an all-in-one mental health CRM. The AI receptionist responds to inquiries in seconds, books consultations 24/7, and keeps your clinicians' calendars full. You can see it in action at productivetherapist.com/simple intake. All right, on to the episode. Hello and welcome back to the Productive Therapist Podcast. You're awesome. You're doing good work. And I just want you to know that I appreciate it, even though we don't know each other, or maybe you do. So today I had a really fun conversation. This is another episode of two nerds talking about nerdy things. Today I got to talk to a new connection named Justin. He's actually the co-founder and CEO of Aria, which is a practice automation platform for growing group practices. Very interesting guy. He spent the past decade building health technology for organizations of every size, from solo practices to large systems like Optum, Providence, and Seattle Children's. And they have a focus on claims, insurance eligibility, and revenue cycle tools. So we got really kind of deep into AI and automation and running a practice and efficiency, all those kind of fun things. And Justin brings that experience that he has to the back office of practices, helping clinicians spend less time on admin and more time with clients, which is awesome. He lives in Seattle and he plays ultimate frisbee. So I hope you enjoy this conversation with Justin from Aria. Hi, Justin. Welcome to the podcast.
Happy to be here.
Yeah. It's always interesting to me to talk to people, well, of course, who have shared interests. And like we were talking before we hit record, we definitely have some alignment and some like synchronicity on the things that get us excited. And so I'm pretty stoked to talk to you about AI, private practice, automation, all those kinds of things today.
No, I'm super excited to talk about it. I love how kind of we came together, and it's kind of rare at times. I know we're just talking about that, where we do have that really great overlap of not just interest, but I think experience too. And what is it like to kind of be working with private practices and applying some of the stuff that wasn't even around 6 months ago?
Yeah, it was awesome. We are on the forefront of some pretty cool things.
We are.
So like you and I actually just met not that long ago and clicked pretty quick, but I would love to hear for myself and for my audience, like a little bit about your story and how you founded Aria and kind of what that journey has looked like so far.
Yeah, for sure. The short story is, I come from a family of clinicians, so physicians and pharmacists. And I was a black sheep who studied computer science.
Oh, nice.
And, honestly, that came more specifically from just a really great love for building and designing. And whether it be Legos or like painting back in high school, I was a pretty artistic kid, and I ended up realizing that coding is actually an incredibly fun art form. And I know you're nodding your head. Like, have you kind of felt that builder rush from coding and using maybe Cloud Codes and stuff like that?
Well, it's funny you asked that. Absolutely, because I just was playing around with Fable 5 and
Yeah.
the newest version of high-powered version of Claude. And I'm not a coder. I'm not a computer science guy, but I'm a creative entrepreneur. So I just built something called the Intake Quest. I'll have to show it to you, actually. And I built like a gamified experience with some tools that help therapists improve their intake process. So yeah, I'm having a blast with it, even though I don't have any actual skills besides my creativity.
Right, but it's that the creative process still gets it does absolutely get itched. Like the itch gets itched, I guess.
Scratched, yeah.
Scratched. Thank you. It gets scratched, right, when you're building that. And so, for me, it was a realization like, okay, actually coding is really fun. And so, you fast forward, I am also, though, kind of given where I grew up and who I was around and the space and setting, was really drawn to the impact that healthcare has on humans and on all of us in our communities. And so my thought was, great, I love to build. I'm good at software. I should go apply this in healthcare. So I've been in healthcare now for about 7 years, both on the clinical side and also on the admin side where we are today.
Mm-hmm.
And so within Aria, in the context there, I was at a kind of a crossroads where I realized I can kind of choose who do I want to help. And the people I decided was rooted in my own experience in therapy. I went through a bout of depression and I had to find the right therapist to kind of help me. And I found the right one, and she was amazing. She really
Mm,
turned my life around. And I feel a really deep sense of gratitude for the work that she did to help me. And I know my story was not alone. I think a lot of other people, friends, some family have that common thing. I'm sure you've done that in your practice, Uriah. And, on behalf of everyone else you help, like, thank you. And for me, my thought was I can build, I can be creative, but it's ultimately, I think, in service of certain people. So who do I want to help? And I made the decision I wanted to help therapists. I wanted to help clinicians as a thank you for this. And I didn't even know particularly how. And so the way I did it was I actually just ended up interviewing therapists in
hmm
my network, friends of friends, and being like, "Hey, what's like the hardest part of your job? What's like the thing
hmm
that's really like difficult?" And two things kept coming up. Right, one was some patients were really emotionally draining. And then the second one was the admin work that has to get done to help clinic clients is actually like a mountain. And it depends on different
Right.
settings in your group practice or private practice or community health, but those are really common through line. And so I was like, okay, I don't know if I can really help with that first one. But the
Right.
second one, maybe there's something I can do there. And Aria really is truly just a outcome of asking, what's that admin issue? How could I help solve that? Great, I solved it. What's the next thing? And then what's the next thing? And so
hmm
today, we offer kind of a suite of different automations to help practices reduce that admin burden. But it's
hmm
been completely anchored from day one in just talking to people, hearing them, listening to them, and solving their problems, and just doing that again and again and again. Yeah.
That's so cool. I like several aspects of that story, but I have to, this is my therapist brain kicking in, even though I'm
Yeah.
retired. I have to ask you, like, so what was that conversation like with your parents or your extended family of like, I actually think I want to go a different direction and do something that's maybe not what everyone else is doing. Was that hard or was it fine? Was it easy?
Actually was very encouraged, funnily enough. I
Oh,
think
good.
like I think a lot of folks were like, yeah, no, the clinical world is has its pros and has its cons, and they saw that I really like building, and they wanted to cultivate that. I have a lot of gratitude to my mom for really seeing that in me and being like, okay, go and really explore that. And she helped me learn a lot of different mediums,
hmm
and so they I'm really blessed to have a really encouraging set of parents to push me there. Yeah.
That's great. And I like also your story about being, having your personal experience with therapy and then deciding like, hey, I want to give back and I want to serve this community. And I also see a business opportunity. It's funny,
Yeah.
I had a couple of different podcast interviews in the last, I'd say 3 or 4 months, where it was like a very similar story, like a bookkeeper, a CPA, like a web
Yep.
designer, and now talking to you. And I love that. I mean, obviously, if you're just a creative, smart entrepreneur and you see an opportunity and you want to create a solution and you're not super connected to the industry, that's fine too. But I think
Yeah.
it's better if you like, if you care and you're invested in like, hey, I want to help the helpers, and that's kind of what you're doing. So yeah, thank you for that. I appreciate that.
And so you're right. I think a big thing in my experiences now of kind of working on different companies is realizing that what you end up building shifts over time. So I'm sure
hmm
your listeners maybe like know a lot of kind of the startup journey, but a big part of what people talk about is the idea maze. This idea maze is like no one ever starts where they are like no one ends where they started. And
Right.
you kind of enter this maze and you're like bumping into walls. You go left, right, trying to figure out what's the right way to help solve it. And the through line, if you do it right, is the people you're helping, the customers you're helping should be the same, but the way
Mm-hmm.
you help them continues to get figured out as you're kind of bouncing around the walls. And so I've done this a few times now where I really realizing like you have to not just love the problem, and you definitely shouldn't just only love the solution. You really have to love who you're trying to help, because that's going to be the one consistent through line. And if you're not motivated and interested in that,
Yeah.
then you fall off, and that's where I think a lot of companies fail. Yeah.
I really appreciate that. That's a really good insight. That's honestly worked really well for me because I started productive therapist to solve my own problem and then realized
Yeah.
my friends and colleagues had the same problem. And I've always felt like, therapists are my people. They're my peers and my colleagues. And so that has kept me going for sure. And the products and services that we offer have changed over time, for sure. But like just wanting to help therapists and wanting to make their lives better, that has stayed consistent. So that is true. It helps.
Yep.
Yeah. So it's changing
Yeah.
all the
No, totally.
time.
Yeah.
This is changing all the time right now, but I'm curious. Let's talk about like AI in the modern private practice, solo group, whatever
Mm.
that might be. Where do you think it belongs and where should owners stay cautious?
Yeah. It's a great question, and um, I think when you hear the term AI too, I think it needs to be kind of disambiguated, and there's a lot of different pieces there. So I'll start with maybe this framing. I think there's the generic AI tools that are not at all specific to kind of behavioral health or even healthcare in general. And so that's like your Claude, your ChatGPT, your Gemini, right? And there's uses there. And then I think there are specific vendors that are applying AI to the specific needs and pain points and problems that private practices face. I know you and I are both kind of in that realm. Neither of us are making a generic, competitor to Claude. And
Sure.
so I'll first with kind of that disambiguation, right? And so I think as a private practice owner, I think there's a world for both. We work now with dozens of practices around the nation, and I think the ones who are I'm seeing the most operational financial gains are able to leverage kind of like, okay, where can I maybe write my standard operating procedure SOPs? How can I get that more streamlined through the use of like a Claude or a Gemini? But then how could I use a tool like what you're building for our intake, more specifically to have AI there, or for a receptionist, or maybe what we're doing with Aria around eligibility checking and claims kind of scrubbing. So that's kind of a different use of AI. And in many ways, it's like you really want to think more about what is the problem you're facing and really be really clear about that, and then work backwards to, you know, how could AI be used there? What is the right tools for that? Do we even need AI for that? Like, could I just be like
Hmm.
a, there's other tools that kind of do more deterministic scripts that can solve those problems. So that's kind of a broad answer, but I think we can dive
Yeah.
into any part of that.
I like that.
Yeah.
There's definitely definite use for the
How do
general
you think about that?
tools. Yeah, I agree with you. I
Yeah.
think there's definite use for the general tools. And for me, it's more around like marketing and operations and those kinds of things. But then when you get into like, obviously anything dealing with PHI, you have to use a specific tool that's HIPAA compliant, that's industry specific for us. So I like that. Yeah. I was talking to some of my practice owner friends this morning in
Yeah.
one of my mastermind groups, and we were talking about like, do you feel comfortable connecting Claude to like your Gusto account or your QuickBooks to like access data? And I was like, actually, yeah, I do. But if Claude popped up and said like, hey, can you give us access to Simple Practice so we can help you with your clients and your clinical practice? I would say, no, I don't think so. At least at this point in time, right? So I think a lot of
Yeah.
therapists are on the fence or against AI, and then there's a handful that are,
Yes.
sort of more early adopters and those kinds of things. It's a very interesting divide. Have you noticed that at all in your work?
Oh, for sure, for sure. And I think a big piece of it is, I mean, there's so many there's so many aspects to AI, and whether it be broadly like the environmental impacts, how it affects jobs, and then more specific. So that's kind of more like as a human, right? And in living society, how do you think about that? And then there's me as a business owner, and then how do I think about where AI should or shouldn't be in my business? And I think on the business end specifically, I also think there's a big divide between where is AI related to clinical judgment or anything touching the patient versus AI also on the kind of the admin side, like connecting Claude with Gusto,
Hmm.
connecting Claude with my QuickBooks, and kind of seeing data there. So, you know, I think the ones that we work with, there's an acknowledgement that there are really an incredible kind of gains to be had to streamline the operations of a practice with the adoption of AI carefully. Um, and I think those gains are starting to be actually realized. So it's not just a theoretical thing. Like people are seeing in their bottom line or as they look at their expenditures, how as you bring automation in, it can actually reduce the cost there. But I think it requires first and foremost, like the practice owner has to believe like this is another tool for that.
Right.
I also do see moral quandaries that are happening all the time of like how do you they ask me like how do you use AI specifically and like are you using the big models? Are you using local models? How's the water consumption? Like, it's an
Mm-hmm.
incredibly varied conversation that folks and I think clinicians particularly are very conscious of the moral implications of it, and it requires, I think, for us and on our side and other companies too, about being really clear about kind of what is our stance on this. I don't know. Have you been seeing that kind of like AI ethics? Like companies are kind of releasing statements around that and how they think about that.
Yeah, I think it seems pretty unique to this particular technological revolution because I don't remember people talking about like I guess I'll just use the internet, like in such a way.
Yeah.
Social media, there was concerns about that. I've always been concerns about that, but not in the same kind of
Yep.
existential sort of existential threat and like moral and ethical concerns. So I think it's really unique in that way. So it makes sense that there's a lot of
It is.
like there's divided opinions and divided opinions inside of individual people, right? I think it's
Yes.
a unique spot we find ourselves in. Yeah.
Are you finding in your experience kind of talking to folks, are the number of early adopters growing? Or do you feel like folks are kind of getting more entrenched in their view of AI?
I don't know what the actual percentage split might be. I mean, I spend a lot of time in
Yeah.
Facebook groups with therapists, listening to them talk and like, engaging in conversation about all kinds of different things related to business. And of course, AI comes into that. I do enjoy more so hanging out in the groups where people are talking about the exciting things they can do with AI. So I don't know. Yeah, it's interesting. It's definitely, if I had to guess, this is mostly anecdotal, but I would say probably 60-40, where like 40% of therapists are on board and interested in like wanting to learn and apply things. And then maybe 60% are like, I'm not sure.
That's actually higher percentages than I would have guessed. It's closer to like 80-20. 80
Yeah.
being like I think less in favor, and then 20 there. So that's actually kind of encouraging to hear that there's more who are curious about it.
I'm either optimistic or wrong. I don't know. Before we continue, I want to tell you about my product, Simple Intake. As a longtime practice owner, I always had the same problem. Too many inquiries were slipping through the cracks. So I built the solution. Simple Intake is an all-in-one mental health CRM that actually works. It responds to inquiries in seconds with an AI receptionist, follows up automatically, and schedules consultations 24/7. So your clinicians stay booked, you stop losing new clients, and you finally get your time back. You can see it in action at productivetherapist.com/simple intake. All right, let's get back to the episode. So I would love to talk with you about automation because I know that's a big part of what Aria does. And it's so interesting because I've been talking about automation for years, but for the longest time, the number of things that you could automate in a modern private practice was so limited, right? It was basically limited to the functionality of your electronic health record software, like auto charging credit cards or, maybe some online self-scheduling or something like that. And it's amazing what's possible now. So, what is it about automation that excites you, if it in fact does?
Yeah, no, automation does excite me. You know, there's this crazy statistic that talks about just like the amount that we as Americans spend
Hmm.
on healthcare administration in the US. The US healthcare administration is like, or US healthcare spend annually, I think is $5.4 trillion. As
Wow.
Americans, we spend 960 billion on just the admin side. So not the clinicians, not like you who are actually, serving patients, but just the admin side. 960 billion is ridiculous, right? And then on the flip side, you have this other piece, which is like, you know, I heard this crazy one in 2024. For the first time ever, there were actually more behavioral health visits in the US than there were primary care visits. Have you heard that
Interesting.
before?
No.
It's fascinating. Yeah. So in 2024, there was 66 million behavioral health visits, and then primary care, I think, was 62 million. So that was the first time it inflected. So what's happening is just like there's a wave of more and more folks who are trying to seek out mental health services, and I'm sure your audience can see and feel that. Now that's being gobbled up in large part also by the
Hmm.
VC platforms online, like
Right.
Headway, Alma, and all that. And so not everyone's equally seeing where that demand is coming in, but the
Hmm.
demand is growing and it's increasing. And so you kind of look at those two pieces, which is just like, high demand, huge spend on admin. And as we all know, the more and more patients want to see, practices are growing, they're adding more clinicians. And when they do that, need to increase their admin capacity to reach all the patients that are coming in. And so what excites me is, as just a person who thinks about how like resources should be spent, why should we be spending that much money on admin? That as opposed to helping clinicians either increase their wages, reducing the cost for patients as they need to see folks, or just like change the shift of that. I think automation is a huge enabler. I think historically it's been like, how do you offshore, and go there? And I think automation is changing that now, where there were things that couldn't really be automated before because of the way that, just the state of technology. And what's shifted now is we've gone to a spot where instead of just purely rules-based systems that are like, if this, then do that, you can
Right.
create kind of these systems that are able to reason about kind of the broader context of the state of your practice and make the correct decisions administratively for what should be happening. What does that mean more concretely? Like, you know, um, for what we do at Aria, for example, deep coordination benefit and eligibility checks. So it's one
Hmm.
thing to say like, Justin is, eligible or not, but then it's like, okay, let's dive in. What are his mental health benefit plans exactly? Are there any limitations on the number of sessions or how virtual is going to be reimbursed as opposed to in person? Really, and that can be like deep on page 57 of a PDF that a
Right.
payer plan gives you, right? Being able to extract all that out, that wasn't really tenable before with thousands of insurance plans, that now can be tenable, right? Coordination of benefits. If you see Medicaid and Medicare patients and they have commercial and they have Medicaid and Medicare, how do those
Mm.
mesh together? And how do you make sure that you're, as a practice, charging the correct ones and the correct timeliness? And that's largely been historically kind of a human judgment issue where we need to kind of look through that. That can now start to get automated with the kind of
I like
state of
that.
what we're doing. So those are,
Yeah.
and there's pockets of that all across, I think, the revenue cycle that's radically changing with kind of what's changing with automation.
That's cool. I have a couple of specific questions for you. Going back to what you said about the incredibly high spend on admin in the healthcare industry,
Yeah.
what kind of things does that encompass? Like, what is all in there? Because when you say admin, of course, we have a virtual staffing business, so I think about like the humans that are the
Yes.
admin assistants, essentially. But are there other things that are included in that spend? I'm sure it's more than a couple, but what would you say about that?
Yeah, it's honestly mostly the actual staffing on the
It is.
admin
Okay.
side is
Okay.
majority of that. Admin also includes though like a lot of technology, so your EHR, your
Hmm.
CRM, your
Hmm.
and then of course we're talking about all of healthcare, right? And so you go in the hospital systems, everything that related to, I think, facilitating like prior authorizations and
Right.
deep denial work, complex billing. So there's like specific software and then really specific labor that goes into all of that as well. So admin is basically that entire bucket of both technology and staffing to
Got it.
make sure that providers get reimbursed and get paid. Yeah.
The talent and the tools, as I like to say.
Yeah.
Yeah.
That's a good way to
Okay.
put it. Yeah.
That's good.
Yeah.
So for the listeners, can we make it like a quick sort of multiple choice? What do you call that? Like a menu, if you will, of the things
Sure.
that can be automated. I'll just say a couple of things that we're trying to automate, and you can tell
Yeah.
me the few things that Aria automates. So for us, not talking about the human side of things, but the software side of things, we are trying to automate the quick response to initial inquiries. So someone calls the practice, AI receptionist answers, has a helpful conversation, can automate the scheduling of a consultation call with the human.
Yeah.
And then also same kind of thing, but with an AI chatbot on the website. So those are a couple of the things that we are actively currently automating for practices, and it's very, very helpful. So what would you add to the list for what you guys bring to the table?
Yeah, I mean, I think, and we talked about it in our last conversation, there's a really clear handoff actually. So you
Hmm.
get scheduled, that's great. Now let's say that assuming the provider is an insurance-based provider, are they eligible? What's the kind of situation with their benefits verification? That historically, I know some EHRs offer the ability to do a quick verification. You actually talk to
Hmm.
practices, a lot of them don't trust that because it's been
True.
wrong. So what has that been
True.
happening? Folks, intake teams have had to log in to esoteric payer portals, go through 2FA, put in the information, get all that out, put that back into the EHRs and admin notes, right? And then make sure to communicate that to the patient. So on our side, we automate that entire piece. So that is
Hmm.
completely done,
Huge. That's huge.
and without having to touch that. Yeah.
That's great.
So
I'll
that's
tell you this, like for our team, we've
yeah.
always told the therapists that we work with, like, hey, we will help you with some insurance tasks. We will verify benefits. But the things that we don't do include calling insurance companies, waiting on hold, and checking on claims or having long phone calls to just check benefits. And people understand that. So what you're saying essentially is that you can do I think you said deep verification of benefits that's accurate to a higher degree and probably faster as well. Is that true?
Yes, way faster. So like the
Love
average
that.
person, I think if they want to do it manually, you take a couple minutes. We do it in 11 seconds. And we do
Whoa.
it in 11
Okay.
seconds because we have all this mapped out. Yeah.
Yeah. That's so cool. Okay, so you added to the menu checking and verifying eligibility and benefits. Is there anything
Yes.
else that you guys automate?
Yeah. Yeah. So another one is kind of continuing down this path, right? Your physician or clinician sees a patient, the note gets done, get ready to be submitted. At that point, a lot of practices are actually changing some things in the claim before it's sent out. Not all of them,
Mm-hmm.
but sometimes
Mm-hmm.
folks are changing their rendering provider because it was an associate or intern. Maybe they're changing what the modifier should be on the bill before it's submitted. So that takes manual process that a lot of teams are doing on the claim submission side. The way I like to say is like if anyone's touching your claims before it's sent out, that is an incredibly useful case of automation. So we would
Okay.
automate that. We work with practices to eliminate the need for any person to have to touch a claim before it's sent out.
Wow. That's
Yeah.
amazing. I don't think that was possible a couple of years ago, was it?
Not well. No, I think,
Yeah. Okay.
and another thing, Uriah, is really interesting is I've worked in health systems, so like Optum, Providence
Mm-hmm.
Health. These are big ones. And to be honest with you, the answer to your question is for big multi-billion-dollar healthcare systems, they actually
Right.
have been having this, but it
Yep.
hasn't really trickled down to I think the mid SMB market in healthcare because of the cost it takes to set that up and
Mm-hmm.
and and maintain that. That's really shifted. So in many ways, it's like broader accessibility of the things that big billion-dollar hospitals have been able to
Right.
do are now accessible to smaller practices.
I like that. Yeah. And
Yeah.
SMB, small business, right?
Small business, small medium
Yeah. Okay.
business. Yes,
Small,
yes.
medium business. Yeah. Yeah. Nice.
Yeah.
I remember the first time, this is probably last year or the year before. I was on some website and I was doing a demo of their tools. And it was basically a chatbot on a website, but
Yeah.
this chatbot was integrated with all the things. So it was
Yeah.
able to help the person select a provider, check their benefits, get scheduled with said provider, like basically start to finish, do all the things. And I was just like blown away and I was
Yeah.
amazed. I was like, I want that for my practice and my friends. But then I realized that these are very powerful tools, very expensive tools. And like you said, large health systems, and who knows how much that would cost. But I like that you're saying that those kinds of features and advantages are coming to practices that are small and medium, which is honestly great. I love that.
Yeah, absolutely. And we're not the only ones to be clear. I'm not trying to just talk about my book. Like this is happening. And I think the
Yeah.
accessibility of I think automation that's been otherwise kind of walled away or garden these like, walled gardens are now finally more accessible and economically viable to bring to
Yeah.
other medium-sized businesses.
That's amazing. Well, I know we could talk for a long time, but I want to wrap this up with two things. So let's just say that my team of amazing virtual intake coordinators are listening to this podcast and they're like, oh no, Justin and Uriah are planning to make our jobs obsolete. What
Yeah.
would you say about that? And then I have one last question for you.
Yeah, it's a great question. The way that I look at this is kind of the admin work that's been done right now. Um, you can think of it as like in my mind, it's kind of like 12 buckets of stuff that folks have to
Hmm.
do. And I think all of those 12 things are eligible to be largely automated. Now, as we both know, working with AI systems, you still need someone to drive the car. Like the car can
Hmm.
go, but you need someone to drive it. I truly believe that the future of where kind of um, assistance in the healthcare back office is going is there's going to be a fewer set of folks who are going to be like superheroes that know how these systems work and know how to guide, train, and fix them because these are not perfect systems. AI is not this until we reach a world where it's this crazy super intelligence. Before that moment,
Hmm.
it is needs humans to drive that. And so I genuinely think what's going to happen is you still need people, and the people that are there are actually going to be higher paid. They're going to be
Hmm.
at a level where they are basically owning the work that would have otherwise been done by a team of 5, 10 other folks. And they're now facilitating the use of how AI is running the system. And so what it relates to for our customers, for example, we actually are working particularly with group practices that are growing, where they already have some existing folks in house, maybe 1, 3 admin people across intake, billing, what have you. And they're like, great, I'm at 20 clinicians. I want to get to 50 clinicians. And instead of adding kind of like that third, fourth, fifth, sixth admin person to reach that, it's about how do you supercharge and superpower the existing 3 there so their capacity grows to reach and be able to support a 50, 70 clinician practice. That's, I think, the future of where we're going. So it's not so much about necessarily pure replacements. It is about the number of openings, I think, will shrink as the capacity of the individuals that are already at the practice will grow when they harness the use of AI.
Yeah, I agree with you 100%.
Yeah.
And what I tell my team is that these tools are not intentionally designed to replace you, but they're intended to empower you, make your job and your life easier. And I think you made a very good point. And the group practice owners that I consult with, they very much want to grow. But they would
Yes.
like to optimize and streamline their systems so they don't have to like have a huge admin team. So basically do more with the same level of staffing. And I think that makes a lot of sense because 100, like right now at least, and for the foreseeable future, you definitely need a person
Oh,
overseeing
yeah.
any kind of agentic workflows. I do it with all my my AI tools, and I'm like, I definitely don't want to let them run my business without me because that actually would not be a good thing.
Yeah.
You know?
100%.
Yeah, human in the
Even
loop is important.
it's important. It's needed. I don't think it's going away anytime soon. I
Yeah.
truly don't. There's talk about like, do we need less software engineers? I'm hiring software engineers, and the reason is not because I
Hmm.
don't think AI can do it. AI is absolutely radically changing the capacity of a single software engineer,
Right.
but you
Right.
still need one to drive the car and guide these agent systems, as you know, kind of work in Fable and everything.
That's so cool.
Yeah.
Well, tell people where they can find out more about Aria and some of the awesome work that you guys do.
Yeah, for sure. You can check us out if you're curious. I'll say so. If you are a group practice owner and you are growing and you want to basically, as we just talked about, how do you streamline those operations as you grow? Come check us out. We're heyaria.com. And then we actually have a promo, Uriah, for your guests and listeners. If you go to heyaria.com/productive, we are giving 1 month free to any of your listeners there for the practice reporting tool. So this is a tool that allows you to see kind of what is the state of how your practice is running, both financially, operationally, and on your clinical team, and gives you some great insights into kind of where you are there and where you are with the benchmark of other kind of practices of your size. So we're offering that for free for any listener here. Yeah,
Fantastic. We'll put that in the show notes. Thank you for doing that.
for sure.
heyaria.com/productive. I like that.
Yeah, yeah.
And definitely go check it out and learn some more. Thanks, Justin.
Thanks, Uriah. Appreciate it.
That's it for today. Thanks so much for joining us. If you enjoyed this episode, please leave us a review and hit the subscribe button to make sure you never miss an episode. If you're looking for more personalized help, you can reach us through productivetherapist.com. Thanks so much for listening. We are Productive Therapist, and this is the podcast that helps therapists get more done and have more fun.